We will be testing the middle head of the deltoid muscle. The proximal attachments are the acromion, clavicle, and spine of the scapula. The distal attachments are the deltoid tuberosity of the humerus. It is innervated by the axillary nerve and abducts the humerus at the glenohumeral joint.
My name is Tanner. I'm a student PT. I'm going to be examining your shoulders today. I'm going to be running you through a series of range of motion and muscle testing. Is that going to be okay? All right, so let's start out with having you put your elbows by your side, flexed at 90 degrees. Good. And let's see if you can raise up your elbows. Good, on each side. Try again. Awesome.
The physical therapist has noticed a discrepancy in the active range of motion at the two sides.
All right, so now I'm going to test your range of motion without you activating your muscles. So just let me have control of this elbow. Good. One more time. Great. Now I'm going to back you off to right here. Can you hold this position?
The physical therapist provides perpendicular pressure at the distal humerus in the direction of adduction while stabilizing at the upper scapula, ensuring their hand is not interfering with the middle deltoid muscle belly. The patient presented a muscle grade of 5 out of 5 because they were able to hold a contraction against.
Hello, class of 2021. We'll be guiding you through the manual muscle testing of the anterior deltoid. The anterior deltoid flexes, medially rotates, and horizontally adducts the arm at the glenohumeral joint. It attaches proximally to the lateral clavicle and distally to the deltoid tuberosity of the humerus. The anterior deltoid is innervated by the axillary nerve. Let's look at how a PT should test the anterior deltoid.
Hi Ryan, I'm Michael. I'm going to be your physical therapist today.
Hi.
So we're going to be doing some testing of a muscle in your shoulder called the anterior deltoid.
Okay.
So the first thing I'm going to have you do is move your arms up and out in front of you, just like this, a little bit outside of directly in front of you, okay?
Okay.
Nice job. I do see you're lifting your shoulder a little bit here. Can you try again without lifting that shoulder? Okay, bring them back down. Next thing I'm going to do is take you through that motion myself. So just let me move you, relax into my arms, okay?
The expected passive range of motion for the anterior deltoid is about 120 degrees in this position.
Great, and now we're just going to do the strength testing, okay?
Okay.
So I'm going to move your arm into flexion, a little bit of horizontal abduction, and external rotation. Can you hold that there? Nice. And now I'm going to apply some pressure. Don't let me move you. Hold, 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 hold. Nice. And now same thing on this side. Can you hold here? Okay, let's try that one more time. Can you hold here? No.
Patient is graded a 5 out of 5 on the right and a 3- on the left for falling into the second arc of motion. There is no gravity eliminated position for the anterior deltoid.
Today we will test the posterior deltoid. The deltoid attaches proximally to the clavicle, acromion, and spine of the scapula, and attaches distally to the deltoid tuberosity of the humerus. It is innervated by the axillary nerve. We'll be focusing on the posterior fibers whose primary actions include extension, horizontal abduction, and secondary actions include abduction and external rotation.
Grant, we're going to be testing your posterior delt, so can you do this action for me? All right, and now we're going to do it passively, so just relax. Okay, now we'll go to the other side. All right, can you hold this position for me? Okay, and now I'm going to apply some resistance.
The PT will stabilize the ipsilateral shoulder and a force will be applied in the direction of flexion and adduction.
All right, 3, 2, 1, meet my resistance. Okay. And now I'm going to have you lay down on your right shoulder so we can take a look at your left. All right, as reference, this is the movement I want from this side. All right, now my hand's just going to be a shelf. Can you do that movement for me? Okay, so on your right, you're a grade of a 5, and on your left, you're a grade of a 2.
We will be demonstrating the manual muscle test for the latissimus dorsi and teres major. There is no horizontal plane position.
I'm Joy, and I'm the student physical therapist. We're going to test some of your back and shoulder muscles. Is that all right?
Yeah.
Perfect. So you're already in tank top. That's all we need. I am going to use some palpation and touch. Is that all right with you? That's comfortable?
Mm-hmm.
Okay. So the motion I'm going to have you do is moving your hand towards your back pocket, and we're going to do it while you're lying down on the table. Want to give it a shot?
Yeah, sure.
All right, let's do it.
The latissimus dorsi attaches to the thoracolumbar fascia, iliac crest, and spinous processes of the 6 inferior thoracic vertebrae and the floor of the intertubercular groove of the humerus. It is innervated by the thoracodorsal nerve, and it acts to extend, adduct, and medially rotate the humerus. Secondarily, it assists in tilting the pelvis and extending the spine.
The teres major attaches to the dorsal surface of the inferior angle and lateral border of the scapula, and to the medial lip of the intertubercular sulcus. It is innervated by the lower subscapular nerve and does medial rotation, extension, and adduction of the humerus. For this test, the patient should lay prone with the shoulder in extension, adduction, and medial rotation. The patient is backed out of full range of motion, force is applied in the direction of abduction, slight flexion to the distal humerus, while the examiner's free hand will stabilize contralaterally, either on the shoulder or pelvis. As you can see, the patient displays a grade of 5 out of 5 on the right and a 3+, 4- on the left.
Some shoulder issues going on. Yeah, okay, so I'd like to do some assessments on those. The first one I'd like to do is called a manual muscle test. So in order to do that, I'd like to see how your joints and your muscles are moving. Would you mind moving your first layer for me? Yes?
Sure.
Would you like a gown or a sheet to help you at all?
No, it's okay.
Okay, great. So let's have your first layer removed and we'll be face down on the table, please.
The primary muscles acting on shoulder medial rotation are subscapularis and teres major. The attachment of subscapularis is from the subscapular fossa to the lesser tubercle of the humerus. It also stabilizes the glenohumeral joint and is innervated by the upper and lower subscapular nerve.
Teres major attaches from the inferior angle and lower lateral border of the scapula to the medial lip of the intertubercular sulcus of the humerus. It is innervated by the lower subscapular nerve. The secondary muscles helping with medial rotation are latissimus dorsi, pectoralis major, and anterior deltoid. The PT places a towel under each arm so that the head of the humerus is properly situated in the glenoid, isolating rotation.
Lift your palms up towards the ceiling. Okay, great. I'm gonna move it for you now. You can relax your head. Just gonna do this motion. Great, can you hold this for me? Great, now I'm gonna apply some resistance. Don't let me move you. Hold, 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 hold. Good. Same thing on this side. I'm gonna move you through some motions. Great, can you hold this for me? Try it one more time. Can you hold this for me? Okay, so can I have you scooch over to this left side for me, please? All right, just go ahead and let your shoulder ankle off the side there. Great. This time I want you to hang your arm straight and produce this movement for me, please. Can you do that? Perfect. So I would assess the patient as a 2 on the left and a 4+ on the right.
This video demonstrates manual muscle testing for the lateral rotators of the shoulder, specifically the infraspinatus and teres minor.
Hello, Chloe. My name is David. I'm your PT for today. Now, I understand you're having some shoulder issues. We're going to run some tests, test your lateral rotators, and in order to do that, I need to be able to see the muscle, which I can, but also need to palpate those muscles, and that would require me to put my hands on you. Is that okay?
Yeah.
All right, can you take a seat on this high table? And go ahead and put your face down right here. Lay on your belly for me. So, Chloe, the first step, I want you to go ahead and do this motion with both arms. Can you go ahead and do that for me? All right.
The infraspinatus muscle attaches proximally to the infraspinous fossa of the scapula and distally at the middle facet of the greater tubercle of the humerus and shoulder joint capsule. The teres minor muscle attaches proximally at the lateral border of the scapula and distally at the inferior facet of the greater tubercle of the humerus and shoulder joint capsule. The infraspinatus is innervated by the suprascapular nerve and the teres minor is innervated by the axillary nerve.
Can you hold for me right here? Let's try that again. All right, Chloe, I see that you cannot hold this arm in position against gravity, so in order to eliminate that, I need you to lay on your right side.
Okay.
We're going to run through that same arc of motion just without the gravity. Can you do that for me?
Patient demonstrated a grade of 5 out of 5 on the right and a grade of 2 out of 5 on the left.
We'll be assessing the strength of the sternal portion of the pectoralis major muscle. There is no horizontal plane position. For this test, the patient should lie supine with the shoulder flexed to 120 degrees, the elbow extended with slight humeral internal rotation, horizontal adduction.
Hey Spencer, my name is Jake. I'll be your PT today. I understand you're coming in with some chest pain. What I want to do is a manual muscle test, so test the strength of your pectoralis major muscle, specifically that lower portion, the sternal head. To assess the muscle, I'm going to need to be able to see it, so if you're comfortable, can you take off the first layer of clothing for me? And I'll have you laying on your back.
The proximal attachment is the sternum, costal cartilages, and aponeurosis of the external oblique. The distal attachment is the lateral lip of the intertubercular sulcus of the humerus. The pectoralis major's actions are medial rotation, adduction, flexion, and it assists with the extension of the arm. The examiner will place one hand on opposite iliac crest to hold the pelvis firmly on the table. The anterior parts of the external and internal oblique muscles will stabilize the thorax on the pelvis. Pressure will be applied against the forearm obliquely in a lateral and cranial direction. Spencer was a 5 on the right and a 3+4- on the left.
How you doing? My name is Kaya. I'm going to be your student PT for the day. Your name is Justin, right? Yep. All right, awesome, Justin. I know that you're presenting with some sort of chest pain, so we're going to go ahead and try that out. It's on your left side. I can see your picture there. All right, so the first thing I'm going to have you do is if you could just, if you don't mind removing that first layer of clothes, I need to palpate and feel your muscles just to make sure everything's doing good. Do you mind? All right, do you want some sort of layer to cover? Okay, good. Just take your shirt off and lay with your face up.
We will be testing the pectoralis major muscle with the clavicular head. Proximal attachments are the clavicle, costal cartilage, and sternum, with distal attachments to the lateral lip of the intertubercular sulcus of the humerus. The clavicular head is innervated by lateral pectoral nerve, and it assists in humeral adduction, flexion, and medial rotation. In order to assess passive range of motion, the physical therapist will apply slight pressure to the patient's elbows as they cross their chest. To perform the test for the clavicular portion of pectoralis major, the shoulder will be flexed to 90 degrees, elbow extended, slightly in humeral internal rotation, and horizontal adduction. The physical therapist will apply pressure against the proximal forearm into horizontal abduction, with the free hand providing stabilization at the patient's contralateral shoulder. The patient's right side was a 5. The physical therapist will perform the same steps on the left side. Since the patient is unable to hold the test position, we will go into the gravity eliminated position of seated.
So, Justin, what I'm going to do now is I'm just going to support your arm. We're going to go through this motion right here with that arm. I'm just going to provide support and I want you to move through it whenever you're ready.
The patient is able to provide the full range of motion, making him a 2.
Today we are going to be testing the biceps brachii muscle. The biceps brachii has 2 heads. Its proximal attachment is the supraglenoid tubercle of the scapula for the long head and coracoid process of the scapula for the short head. Both heads of the biceps brachii distally attach at the radial tuberosity and bicipital aponeurosis. The biceps brachii is innervated by the musculocutaneous nerve. The primary actions of biceps brachii are shoulder and elbow flexion, while its secondary action is supination of the forearm. Today we are going to be testing the strength of the biceps brachii muscle.
Alright, good morning Josh. Would you mind lifting both arms up to your shoulder? Alright, okay, let me just test the passive range of motion as well. That's good. Alright, can you hold your arm there for me?
Can you hold this position?
Looks good. Now we're going to be testing the strength of this one, so I'm going to apply some resistance and go ahead and just hold up against my knee. Good. Alright, let's try this arm now. Can you lift this arm up to your shoulder for me? Not quite. Okay, let's test the passive range of motion on this guy. Looks good there. Are you able to hold your hand there? Alright. So let's test this in sideline now with gravity eliminated. Could you lay down on your right side for me? Alright, I'm going to support you here and just guide your hand. Go ahead and lift your hand up to your shoulder. Very good. One more time for me. Awesome. Thank you.
This patient demonstrated a grade of 5 out of 5 on the right and a grade of 2 out of 5 on the left.
The test we will be demonstrating is for triceps brachii.
Hi Jasmine, I'm Lee. I'm going to be your physical therapist today. Today we're going to be assessing your active and passive range of motion as well as the strength of your triceps brachii muscle. In order for me to do that, I need to be able to see it, which I can, and also be able to palpate and touch it. Is that okay with you? Mm-hmm. Great. Can you go ahead and lay down for me? Can you bring your elbows up here and extend your arms like this? Perfect.
Triceps brachii has 3 proximal attachments: long head, infraglenoid tubercle of scapula; medial head, distal posteromedial shaft of humerus; lateral head, proximal posterolateral shaft of humerus; and 1 common distal attachment, the olecranon process of the ulna. It is innervated by the radial nerve, and its actions are to extend the humerus and forearm. The PT has positioned the patient in supine position with both arms flexed to 90 degrees. Note the PT techniques during the testing, like the placement of her hands on the anterior distal portion of the humerus and around the wrist to best apply force in the direction opposing triceps brachii. She has a wide base of support, her center of gravity in close proximity to the patient's, all while confirming the comfort of the patient. Note that the right received a grade of a 5 because the patient was able to hold the position against gravity and fully against the force in the direction of elbow flexion applied by the PT. The PT must put the patient in gravity eliminated side lying position to test the left tricep because the patient was unable to hold elbow extension against gravity. The patient is able to move through the full range of motion in the gravity eliminated position, giving them a grade of a 2 on the left.
This video will demonstrate the manual muscle testing of the brachioradialis and brachialis muscles.
Hi Carrie, my name's Louise. I'm going to be your PT today, just testing the strength of some of the muscles in your arms, which means I'll be palpating for those specific muscles, feeling for those muscles, and then applying some pressure. How does that sound? Is that okay?
That's okay.
Okay, let me know if you have any discomfort.
Okay.
Just going to raise this table up.
For the brachioradialis, the attachments are from the lateral supracondylar ridge of the humerus to the distal radius lateral to the styloid process. The actions are flexion of the forearm at the elbow, and it's innervated by the radial nerve.
So I'll just have you move your arms like this for me.
Carrie is seated, arms flexed at 90 degrees, forearms in neutral position for active range of motion.
Okay, I'm going to start with this one here.
Louise sees a discrepancy in the 2 sides, so begins testing with the side that appears stronger.
All right, and I'll have you hold that there for me.
Louise is assessing the passive range of motion, stabilizing at the posterior arm with a firm infield expected.
And have you hold against
Louise
pressure.
had the patient hold against gravity and is providing perpendicular pressure into extension.
Nice.
The patient demonstrated a grade of 5 out of 5 on the right side.
And I'll have you hold there for me. All right, let's try that again, and hold there for me. All right, I'm going to have you lay down on your side.
Louise sees that the patient is unable to hold against gravity, so she has the patient go into a gravity eliminated position of contralateral side lying.
All right, I'm just going to move your arm through the same plane like this. And can you move that for me? Nice.
The patient can move in the full range of motion in gravity eliminated, so she establishes a grade of a 2 out of 5 on the left side. To test the brachialis, use the same procedure in the forearms in pronation. The attachments for the brachialis are the distal anterior shaft of the humerus and lateral and medial intermuscular septa of the coronoid process and ulnar tuberosity. The actions are flexion of the forearm at the elbow and innervated by the musculocutaneous and radial nerves.
Today we are testing the pronator muscles, including pronator teres and pronator quadratus. Pronator teres attaches to the medial epicondyle of the humerus and ulnar coronoid process and distally to the lateral aspect of the radius. It's innervated by the median nerve and pronates and flexes the forearm. Pronator quadratus attaches to the anterior surface of the distal ulna and anterior surface of the distal radius. It is also innervated by the median nerve and acts to pronate the forearm. Today we have our PT Ashley, who is going to simultaneously be testing these muscles on our patient Molly.
Hey Molly,
How's it going? Good, thank you. Good. So I'll need to have access to those muscles, so I will need to touch your skin. Is that okay today? Yes. Wonderful. I'll have you go ahead and lay down on your back for me.
The patient is supine, her elbow is flexed to approximately 45 degrees, and her forearm is pronated. Note that there is no horizontal plane position for testing these muscles.
And then Molly, when you're ready, I'll go ahead and have you turn your hands away from you. Wonderful. Go ahead and relax for me. I'm just going to passively check your range of motion, okay? All right, so go ahead and relax for me. Wonderful. Molly, I'm going to apply some pressure, so I just want you to resist me, okay? Just do that one more time. All right. I'm going to go ahead and check your other side. As you can see, Molly is a 3+, 4- on her left side because she can hold test position against normal resistance. All right, Molly, we're just going to do the same thing on this side. Okay, just passively checking your range of motion. Wonderful. And then I'm going to apply some pressure, so just resist the best you can, okay? Okay. And Molly's a 5 out of 5 on her right side.
Hi, I'm Mac. I'm going to be your PT today.
Hi.
Hi. What do you prefer to be called?
Mickey.
Mickey. Nice to meet you.
Nice to meet
Okay,
you.
so I understand you're having some problems rotating your forearms. All right. So I'm going to do some muscle tests, try and get a gauge of where we're at, and then we'll move forward from there. In order to do that, I need you to remove your first layer of clothing, if that's okay. Okay, great. And also, I'm going to have to put my hands on you, so I just want to make sure that's okay. Yeah. Okay, great. So, first thing we're going to do.
Today we'll be testing the supinator. This muscle proximally attaches to the lateral epicondyl of the humerus, the radiocollateral ligament, and the supinator crest of the ulna, and distally attaches to the lateral surface of the proximal radius. It is innervated by the radial nerve and supinates the forearm at the radial ulnar joint. This muscle can be tested in sitting or supine. First, we will test it in sitting.
Great. Now,
the shoulder and elbow should be in full extension with the forearm supinated.
Back as far as I'll go.
The PT should stand behind the patient and will provide pressure into pronation by grasping the palm and the wrist at the distal radius. The PT's other hand will support the posterior aspect of the distal humerus, above the elbow.
1, 2, 3. Okay. And same thing over here. Ready? 1, 2, 3. Okay. Now we're going to do one more test. I need you to lay
Next, we will be testing the supinator in supine. The patient's shoulder should be flexed to 90 degrees with the elbow in maximal flexion and the forearm supinated.
And then bring your elbows up, facing towards the ceiling.
The PT should provide support to the posterior aspect of the distal humerus. Pressure should be provided at the distal forearm into pronation.
Okay, ready? 1, 2, 3. All right. Same thing on this side. Ready? 1, 2, 3. Great, thank you.
In these situations, the patient demonstrated a grade of 5 out of 5 on the right and a grade of 4- 3+ out of 5 on the left.
Hi Naita, I'm Tyler.
Hi.
I'll be your physical therapist today. I understand you're having some weakness and tingling in your left forearm, is that correct?
Yeah.
The wrist flexors have proximal attachments on the arm and forearm. The wrist flexors' distal attachments are on the metacarpals, digits, and pisiform of triquetrum.
So what I want you to do is just bring your arms up to like this, and then with palms facing the ceiling, I'm just going to have you bring your wrists up like this.
Okay.
Normal active range of motion for wrist flexion is 0 to 80 degrees.
Good, so it looks like you have some good range of motion to your right here. I'm just going to take you through that same, just let me do all the work here, okay?
Okay.
Besides wrist flexion, the wrist flexors also have muscle actions that include radial deviation, ulnar deviation, and flexion of the metacarpal, phalangeal, and interphalangeal joints.
So despite your weakness, looks like you still have some good range of motion. I'm just going to do a quick test on your right side here.
Okay.
So I'll just support you right here, and then I don't want you to let me move you from here, okay?
Okay.
So hold, 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 hold. Good.
Great.
I'm going to do actually now I'm going to have you come down onto the chair here.
Okay.
Most of the wrist flexor muscles have nerve innervation from the median nerve, but there are 2 muscles with ulnar nerve innervation as well as median nerve.
Good. So now, what I want you to do here is just kind of take me through that same motion, starting from right here, okay?
Okay.
Good. I'm just going to support you all the way. Good. Do it again. Good. Okay.
Okay.
The patient demonstrated a grade of 5 out of 5 on the right. She had a grade of 2 out of 5 on the left.
All right. Thank you, Naita.
Yeah. Thank you, Tyler.
In this video, we will be testing the wrist extensors as a group.
This muscle group, including extensor carpi radialis longus and brevis, extensor digitorum, and extensor carpi ulnaris, originate from the common extensor tendon on the lateral epicondyle of the humerus. Distally, these muscles insert respectively on the dorsal base of the second and third metacarpals, the dorsal digital expansions, and the base of the fifth metacarpal. All are innervated by branches of the radial nerve. Their functions are primarily extension of the wrist and digits, as well as radial and ulnar deviation of the wrist secondarily.
Hi, Eddie. Hello, my name is Danny. I'm going to be your physical therapist today. I heard you're having some wrist pain. Yeah. Okay. We're just going to be testing the strength of the muscles around your wrist today. So first off, I'd like to see you take it like this. Okay, one more time. Okay, let's start with your right side. Can I have you hang your wrist off the table, please? Cool. I'm just going to take you through some range of motion, so don't help me out, okay? Let your wrist hang down. Awesome. Okay. Now, can you hold this position for me? Great. I'm going to provide some resistance. Don't let me move you. Okay. Push, 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 push.
The patient demonstrated a grade of 5 out of 5 on the right. Since there was no movement against gravity on the left side, we are now in a horizontal plane position.
All right, Eddie, what I'm going to have you do is try and move your wrist through this plane of motion here. And whenever you're ready, go ahead, try and do it. Okay.
The patient demonstrated a grade of 2 out of 5 on the left.
Hello, my name is Liam. I'm going to be your physical therapist today. Today I'm going to be assessing the strength of your latissimus dorsi and your teres major. As part of my assessment, I'm going to need to access that area. Would you be comfortable removing your outer layer of clothes? I have a gown, if you would like.
I am okay.
In order to test these muscles, I'm going to have you lay face down on the right side of the table with your head facing that current. Are you comfortable in this position? Can I offer you a pillow?
No, I'm okay.
The patient should be prone with their head rotated to the contralateral side.
So next I'm going to take a look at your range of motion. So if I could have you move your arm back behind you like this.
Latissimus dorsi attaches from lower thoracic spinous processes, thoracolumbar fascia, and iliac crest to the floor of the intertubercular sulcus of the humerus. It adducts, extends, and medially rotates the humerus and is innervated by the
So for this next part of the exam, I'm going to need to move your arm through a range of motion. Are you comfortable with that?
Teres major attaches from dorsal surface of inferior angle of scapula and lower lateral border of scapula to the medial lip of the intertubercular sulcus of the humerus. It also adducts, medially rotates, and extends the humerus and is innervated by the lower subscapular nerve.
Great. And if I could have you hold this position.
3.
So I'm going to apply a force here to try and break this.
The distal humerus.
And I'm going to have you try and hold it against my resistance, all right? So I'm going to stabilize here.
Contralateral shoulder.
Apply a force like this. So on 3. 1, 2, 3.
Right arm, 5 out of 5.
Now we're going to go through the same steps that we did on your right arm on your left arm. So first, can I have you take it through that range of motion? All right, great. And bring it back down. Now I'm going to move it through a range of motion. Is that okay?
Yep.
All right, great. All right, great. And please hold it up here.
All right.
3.
I'm going to stabilize here and apply a force here. On 3. 1, 2, 3.
Left arm, 4 out of 5.